Hi everyone, Dr. Jeff back with Alexis this week, and this week we've got an interesting topic. We're going to talk about when to use an ice bath and when to use a hot bath.
Yeah. So first we'll start, what is an ice bath? An ice bath is a cold tub that you submerge yourself in between 50 to 60 degrees Fahrenheit. So that's 10 to 15 degrees Celsius. And you can soak in that for 5 to 15 minutes to get the benefits.
Hot bath is the opposite, which is kind of what I like. Anyways, and this is something that you're going to run the temperature between your body temperature, which is 98.6 degrees, all the way up to 109 degrees. So my hot tub at 104 degrees is kind of the perfect temperature for a hot bath.
Yeah, so we'll talk about the benefits of a cold bath now. So the target of a cold bath is inflammation. So if you have a sprain or a strain, that's perfect to be icing that. You especially want to be icing that within the first hour of that, as well as high intensity exercise. So it also helps with high intensity exercise because it constricts the arteries but not the veins. So that helps flush out the lactic acid. So that's going to reduce your soreness the next day. It's also really helpful for if you have to return to that high intensity exercise the next day. It's good for a quick turnaround. On top of that, it helps with mental clarity and it gives your immune system a boost.
Yeah, in comparison to a hot bath, it's not very good for inflammation. It actually causes more inflammation because the arteries stay open, stay dilated, more blood keeps flushing in, and the swelling gets bigger and bigger. So if you have a sprain or strain, putting heat on it, especially in that first 24 hours, is not a good idea. Hot bath is really good for chronic pain, for relaxation, for joint mobility, things like that. And again, with heat, you don't really have to put heat on it right away after high intensity exercise. It's more for the next day, the day after. It's more down the road. It's going to help you with that muscle relaxation and mobility and keep you going. There also is some effect as far as mental clarity is concerned. It really helps reduce anxiety. That warmth and soaking it really helps with that. It also does give your immune system a bit of a boost. It's a different type of boost than you get with an ice bath, but you still get a bit of an immune explosion with a hot bath.
And on top of hot baths and cold baths, we also have something called contrast baths. So you can soak for a few minutes in the cold bath and then the hot bath and go back and forth, and that creates something called the Huntington's effect.
Yeah, with Huntington's effect, this is really good for getting rid of inflammation very quickly. As you mentioned before, ice is going to close the muscles or the arteries, because the arteries are muscular walled, so they don't like cold, so they're going to close that artery down, and heat will open it back up again, dilates it. So this contrast bath, what I usually suggest is kind of do it in your hot tub or do it in a bathtub with the warmth. And what you're going to do is you're going to put ice on the joint for about 5 minutes, and then you're going to take 2 minutes, you're going to put heat on it. And then you're going to do 2 minutes of ice, then 2 minutes of heat. You can do that about 5 times each. It takes about half an hour. So what happens is you're going to get this pumping effect. The arteries dilate, the arteries constrict. Dilate, constrict. So this goes back and forth. And what it does, it really pumps the fluid out of that swollen joint. And for up to about a half hour after you stop the program, this effect is going to continue to go on. So be really surprised if you use a contrast bath on a swollen knee or a swollen ankle or any type of swelling, how fast that swelling actually comes out of it. The one thing with an ice bath, though, you have to be concerned about is that it is a shock to your system. So people with either heart issue or high blood pressure, things like that, you really should consult your physician before you undertake that.
Yeah. So thank you guys so much for watching. Hopefully this helped you understand when to do an ice bath or when to do a hot bath or when to do the contrast bath with both. So if you like this video, don't forget to leave a like. Don't forget to subscribe. Leave a comment if you have any feedback for us. And as always at Goldsworthy Wellness, we got you back.